Let's start with the hip joint. The hip joint is a synovial ball and socket joint formed between the head of the femur and the acetabulum of the hip bone. It is a major weight bearing joint, especially designed to provide maximum stability while still allowing a wide range of movements. This balance between the mobility and stability is the key feature of hip joint. Okay, now let's look at the articulating surfaces. The head of the femur is spherical and covered by hyaline cartilage except a small area called fovea capitis. The acetabulum forms the socket and only its lunate surface is involved into the articulation. Around the margin, the acetabular labrum deepens the socket, thereby increasing the stability of the joint. Here, the acetabulum labrum is the important structure which deepens the socket. Okay, it is the reason for increased stability. Next, the hip joint is surrounded by a strong fibrous capsule. Proximally, it is attached with the margin of acetabulum. Distally, it attaches to the intratrochanteric line anteriorly and the neck of the femur posteriorly. The capsule is relatively loose, allowing movement, but at the same time it is reinforced by strong ligaments, making the joint very stable. Next, the ligaments of hip joint. The hip joint stability is mainly due to its strong ligaments. Okay, the iliofemoral ligament is the strongest ligament in the body. It's an important one mark, and it prevents the hyperextension. The pubofemoral ligament limits the abduction, while the ischiofemoral ligament limits the medial rotation. Together, these ligaments forms the strong support system around the joint. These two ligaments are the most important ligaments which gives the strong support to the hip joint. Next, ligamentum teres. The ligament of the head of femur, also called ligamentum teres. It is an intracapsular ligament. It extends from the fovea capitis of the femur to the acetabular notch. It carries a small artery which is important in children, but its functional role in adults is relatively minimal. Synovial membrane. The inner surface of the capsule is lined by the synovial membrane. This membrane secretes the synovial fluid, which helps in lubrication and reduces the friction during the movement. It also forms the folds called retinacula, which carries the blood vessels to the femoral head, making them clinically important. Okay, then blood supply. The hip joint has a rich blood supply, which is crucially for the survival of femoral head. Okay, the most important artery is the medial circumflex artery, which gives the retinacular branches. The retinacular arteries are the anastomosis by the major arteries. These vessels runs along the femoral neck and supply the head. Damage to these vessels, especially in fractures, can lead to avascular necrosis. Clinically, it's important because lack of blood supply to the head of the femur causes the avascular necrosis. Then nerve supply. The nerve supply of the hip joint follows the Hilton's law. This means that the nerve supplying the muscles acting on the joint also supply the joint. Okay, the main nerves are the femoral nerve, obturator nerve, nerve to quadratus femoris, and superior luteal nerve. Okay, there are four important nerves. First one is femoral nerve, then obturator nerve, then nerve to quadratus femoris, then superior gluteal nerve, then movements of hip joint. Okay, the hip joint allows movements in multiple planes. This includes flexion and extension, abduction and adduction, and medial and lateral rotation. Okay, there is a 6 movements: flexion, extension, abduction, adduction, medial and lateral rotation. Okay, because of its ball and socket structure, it also allows a combination of movement called circumduction. Circumduction means combination of all movements. Then muscles acting on hip joint. Different groups of muscles produces movements. The iliopsoas is the main flexor of the hip. The gluteus maximus is the main extensor. The gluteus medius and minimus are the important for abduction and pelvic stability. The adductor group brings the thigh towards the midline. Okay. Stability and applied anatomy of hip joint. The hip joint is the one of the most stable joint in the body. This stability is due to the deep acetabulum, strong ligaments, and powerful surrounding muscles. Clinically, fracture of the neck of the femur can disturb the blood supply and lead to avascular necrosis. Okay, a positive Trendelenburg sign indicates weakness of the gluteus medius, leading to pelvic drop on the opposite side. That means the patient did not stand with support of one leg. Thank you.